How's everybody doing? Good? It's been a good long day. Okay, it'll move to my slides, right? Hopefully. Let me see here. Yeah, perfect. All right, well, good afternoon. We've heard from an amazing group of physicians and nurses today about this disease and what to do about it, how to learn about it. And so I'm going to go over some pieces here. Are my images coming up in the back? I have photos on each slide. And they're not? They may be because they're uploaded here. Okay, so you guys won't get my visuals, but that's all right. So 15 years ago, I was working at Cedars-Sinai Medical Center in this Department of Psychiatry, running support groups there, and a doctor by the name of Dr. Shlomo Melmed inquired if I would be willing to run some support groups for him in his pituitary center of excellence, specifically focused on acromegaly. So I went home, I was really nervous because I said yes, but I didn't know what acromegaly was. It was 15 years ago, so I had to Google it, and then I had to learn how to pronounce it. So it's 15 years. I'm so grateful to be here today and work with Jill and everybody part of this community. And so I'm now going to be focusing on what happens to you when you leave the physician's office and go home, right? What about all that really hasn't been covered yet? I will say this was the very first conference where a physician has focused on quality of life. So I think that was really commendable and to show us all those statistics. My presentation is going to be a little bit different. I am going to be touching quality of life issues as well. Because I come in, I'm a psychotherapist. So I see you typically after you've been diagnosed or maybe on the way of the journey to figure out how to cope and manage your symptoms, right? So we're going to go over all of that. I always like to start with this slide because my patients who come to me, after they see their physicians on diagnosis, which treatment plans, they come to me in a place of primarily mostly depression and anxiety. Can anybody relate to that? Maybe despondent, maybe suicidal, and they need help. So the first thing we want to work on is that you're not your diagnosis, because having that label on you, everything's pretty much focused on labs and treatment modalities and breakthrough symptoms. And so really carving out a piece of your life that's not always focused on acromegaly. I like to teach that the physical and emotional aspects of your life are connected, right? Body and mind, they're all very, very connected. And how well we learn to cope with these stressors will affect quality of life. So we were given excellent information about different categories of quality of life, but what about the things that you used to do that you can't do anymore? Isn't that quality of life? So we're going to talk about that today, and that you are the expert. How many times have you gone into a physician's office and you had to teach the physician maybe about what acromegaly is or what acromegaly feels like? And maybe they said, well, I learned about it in medical school. Well, that's a good thing. That's okay. But it's a small chapter, okay? It's not a big chapter. And so a lot of physicians, especially non-endocrinologists, perhaps have never heard or treated acromegaly. And most importantly, you have to be an advocate. You have to advocate. You have to have a voice. You have to work in tandem with your physician and your entire treatment team. So, psychological challenges, what are they for you? Now, my presentations, I ask a lot of questions, and we could be here for 3 days talking about this, but what are your psychological challenges? Well, let's see. Could it be having a lot of depression or anxiety in your family line, and you've had chronic depression all your life? What about a psychosocial challenge? I have a 91-year-old father and an 82-year-old mother, and they both have chronic diseases, and I'm moving them to my hometown. Right now, I'm in the trenches, right, on how to deal with. That's a psychosocial stressor I'm dealing with. I want to teach you about coping, how to cope, and we all cope differently at different times. And I'm going to go into a very common theoretical model that psychotherapists use, which is cognitive behavioral therapy. So, psychological challenge. How many of you, it took 10 years to be diagnosed? Anybody? 10 years. That's a decade of your life. Over 20 years. There's some hands in the back. Years and years of not being listened to, of not being believed, of going to doctor after doctor after doctor. And then you're hit with this bomb of, okay, so there may be some sense of, an exhale, but then you're confronted with the treatment modalities. And yes, we've learned today that the number one course of action is surgery, and it's pretty much safe, depending around tumor size, and we've learned about that. But what about the psychological aspects of confronting this? What if you're married with 2 children? What if you're just about to go into medical school, right? What's all that about? So how do I incorporate this new information into my life? So I work with my patients about this, even regardless of where they are in the stage of the disease. What about my relationships with my spouse, my kids? What if I have parents still living? And what about my anger at all those people that in the healthcare industry didn't help me, didn't know? And how do we get past that anger? Because you can't live in anger. And we're going to go into acro rage in a little bit and acro fog. You can't live in that all the time because you'll still be sick on some level. So I think I went the wrong way. Let's go here. So psychological challenges. Do you have treatment options? Hopefully you do. And are medications a choice based on what your treatment team feels? So what about the burdens of medication? Anybody find medication compliance a burden? Storage, refrigeration, some of you, time? Somebody said time, thank you. Yeah, all of the things that you have to do, how to get them. What about insurance? Psychosocial stressor? Okay. So, yeah, and I'm sure you know that, Jonathan, and a lot of you do. All of the above. What about breakthrough symptoms? So you're on the path, your levels are good, but you don't feel good. And so you need to try to explain that to your doctor that I don't feel good. I'm tired all the time. Something's not right. So that balance and communication with your physician is really important. A colleague of mine educated me about this one. So I had surgery, and aren't I supposed to be feeling normal now? Right? Aren't I normal? Shouldn't everything be fine? So no, it's a process. You're not going to bounce back into life. It's going to take some time, but with the right tools and support system, we can do the best to get you back to a baseline, if anything, and around quality of life issues. And then what's my attitude about everything? So we've learned about acromegaly all day today, and we've learned about amazing things, but what happens when you leave this conference today, when you go back home, right? Is there any rage? Is there anger? Is there hurt feelings? I mean, what are all the emotions around everything? And what's my attitude? So we talked about comorbidities and the psychological ones that I've identified, mood-related disorders, the anxieties, the depression, everything in between those two. We see a lot of with acromegaly. We see poor concentration sometimes, memory problems, anybody? Can't find a word, some acro fog, it's very real, it's not made up. So make sure to let your family members understand that too. Often family members don't understand these pieces of the disease, it is real. Weight gain and weight loss. Very real and problematic for a lot of people, men and women, doesn't matter. We're constantly hearing about pain and discomfort, and that can be anywhere in the body, unexplainable, low libido, and sleep disturbances. I want to talk about sleep for a second, because I find sleep fascinating. So 24 hours with no sleep. I'm going to put this down. So according to the CDC, a 24-hour sleep deprivation is the same as having a blood alcohol concentration of 0.10. How about that? Ever pulled an all-nighter? How do you feel the next day? A little wonky? Sleep is huge, and you need sleep, and a lot of people with acromegaly struggle with sleep, insomnia perhaps, just worrying in the middle of the night, you know, the what ifs, if there's sleep apnea, which you really want to check out if that's an issue. When we don't sleep, we're more irritable. We're impaired concentration, memory, increased stress. We're just not going to handle that Boston traffic very well, you know. Sleep deprivation has been used, and I think still is, as an interrogation torture technique. You know, we do that. Militaries do that to kind of break someone down, try to keep them awake. Sleep apnea, you've got to rule that out and get some help around the sleep apnea. Less oxygen to your brain, it can be a problem in that regard. So, sorry guys, I keep going the wrong way. So what about social and occupational challenges? So since I've been diagnosed and I've been on this path, have I changed in my relationships with others? Right? So these are going to be questions for you to answer in your own self, right? Deep down inside. Am I pulling away? Do I not attend things? Do I not want to go to that cousin's wedding because of how I look? Am I pulling away from certain events? What about the financial stressors? Can I still support myself and my family? Right? Very important. And are there new financial stressors because of all this? What are those about? And are you dealing with them? And if you do have a spouse that you're sharing things in your life together, working together in regards to finances, to work together as a team, how you can practice techniques of communication, things like that are really important. So I added this question because I wanted to ask my patients about, are pituitary disorders solely responsible for the above issues that I discussed? Like, does anyone have any control to deal with psychological or psychosocial issues to improve theirs? Is there anything that you can do about this? What about stress, right? What about handling stress around having acromegaly, or how to treat it? These are all questions that I think are very important to ask yourself with this illness. So the role of the psychotherapist, and that's me, is that I work with families specifically that have pituitary disorders and their treatment team. So I come in like a big bird and I overlook everybody in the family, because this is not just about the identified patient, this is really about family. How many here are family members? Some of you, I always love to see family members who attend these conferences. We need you. You are also your partner's advocate, and we want to teach you too. It's really important for you that as a family member to really understand what your partners are going through and be educated. And also to validate your story, right? So as far as how you can navigate future narratives, okay? We want to learn, we want to help you validate what's going in your life. So quality of life, what does this mean to you? Hold on, everybody. So we talked about quality of life already, but I really like this one photo about the iceberg. So we're talking about a GH oversecretion. Underneath that, a tumor mass effect, pituitary hormone deficiencies. We're then looking at persistent impairment in quality of life underneath this big iceberg, right, that's underwater that no one can see. Impact on partnerships, relationships, and don't forget the relationship with yourself, self-esteem, really important. Treatment-related afflictions, side effects, impairment of daily activities, and financial issues. All that is below this big iceberg, and it's really important to know that that's what's underneath the water. Studies have shown anyone with a chronic illness struggles with quality of life, especially rare diseases. So you have your own issues of quality of life, and they're also very different. Everybody else, maybe there's an activity that you used to do and you can't do now, or maybe it's a new activity and you've created, kind of increased and done something with quality of life. And then we really want to look at, can you no longer perform activities that you used to enjoy? That's called anhedonia. I always get nervous when my patients who love to garden, like the people that like to get their hands in the dirt, and all of a sudden they don't garden anymore. I always know something's wrong. We usually talk about depression in that regards. So let's talk a little bit about quality of life, which we've learned about already. We're dealing with physical, right? The pain, appearance, changes in body shape and size, facial features, skin texture, sweating. We've reviewed a lot of this. Sleep disturbances for emotional, anxiety, and depression. Cognitive, right? We might see changes in finding that word, and social isolation. That's why I love these conferences, and I will say that this conference has been dynamic because I've seen so many people talk to each other. Half of the time we have to pull people into this room. So the most important thing with our conferences is to have you guys connect. There's nothing that touches my heart more than somebody attend a conference who's never seen somebody with acromegaly meet somebody else with acromegaly. And it's life-changing, and we're a family. And it's really important to come to our conferences, get involved with people, call people to get support when you're having a hard time. So we discussed about quality of life. It's not always 100% achieved. So what about coping? I'm kind of fascinated by this topic, and so I'm fascinated by how people cope. Like, why do people go to church? Is that a coping mechanism? Why do people use cocaine? Why do people really? That's a coping mechanism. Why, whatever they are, right? Your coping mechanism. You know what they are for yourself, the maladaptive and the more positive. Definition are specific efforts which we use as a species to master, tolerate, reduce, or minimize stressful events. Okay? So I've identified 5. Let's go here. I've identified 5 coping mechanisms. The fighting spirit. This is where you're feeling like the illness as a challenge. You have a rational attitude about it. You're feeling okay, like you got it, right? You're an active role player in your disease. You are active. You are going to you're compliant with your medications. You're going into the doctor's office. You're taking notes. You go in with a friend. You're writing questions in the portals, like you're all, everyone knows you there, right? In the pituitary center. And you can exert some control over stress. Anyone ever been in a fighting spirit kind of coping? Yeah, I see some hands. I'm not saying you got to be here all the time. I just want you to know what it feels like. Have that peace in your mind. Anybody know about denial? Anybody heard of that? A denial, avoidance. Anybody have? I see some hands. Not want to participate in any of this? How much more time do I have? I got 10 minutes. Okay. So I'm going to touch upon these. Okay. There's you deny the illness, and you may move into unhealthy consumptions of things, lead to mood disorders. And there's no big deal about acromegaly. No big deal. I'll deal with it next year. Fatalism. Okay, these are people that it's no really big deal. I have no control over it. I'm just kind of passive, There may be some pain behind the eye, but, it's okay. And then oddly enough, people just sometimes go to a place of hopelessness and helplessness. Oddly that may be a coping mechanism, but it's right up there with denial. You do not want to be in this place very long because this will move to mood disorders, okay? Anybody get anxious? What are my labs going to say? I have to go to the doctors. I don't want to, right? You're up all night long researching. Okay, be aware of this. I can't cope unless I know what the future holds. So we have controllable and uncontrollable stressors, right? So controllable are problem solving, decision making, What makes you feel good in your life? You're an active player. Those uncontrollable stressors, I cannot control that I have acromegaly. I can choose the doctors, hopefully, who are in my area. So what can you do? Do relaxation exercise help you? Breathing. I'm not a big breather for me. I like mindfulness exercise. It's hard for me to shut down my mind, right? I tend to be an anxious preoccupation. So mindfulness, which is a very active way of meditating, is very useful. I loved the poem. I had tears in my eyes listening to that poem. Write, do art, and be open to new things. Okay, so you've never crocheted, maybe you try it. Or, something, swimming. Try something where fatigue doesn't get in the way. Managing symptoms, okay, we talked about this a little bit. How do you manage these symptoms? We've talked a lot about symptoms, but there may be Eastern medicine symptoms. There may be chiropractic. There may be better ways of holding a food plan. My thing is find how you can manage your symptoms that work for you, right? So talk to each other. Like, how do you handle the joint pain? What's it like for you to go back to work? And aren't people talking? And all of that. Acro rage. I spoke to someone earlier today who's struggling with acro rage, and the family member actually who's struggling with her son's acro rage. And they know that it's real, but is it okay to take out all of our emotions on family members? Right? So acro rage is real, but what about identifying different coping mechanisms to speak differently? So looking at triggers. What's triggering you to just all of a sudden have that attack of anger and rage? You got to look at all that stuff. And of course it's hormonal, but you need to look at what's triggering it. Is there something that's triggering it? How much time do I have, Jill? 8 minutes. So cognitive behavioral therapy, I'm going to make it really easy. The idea is that there's a situation. There's a fixed situation. Does not change. The idea is that how you think about that situation, your thoughts, what you think about it will affect how you feel, and then consequently affect how you behave. So, situation, you get a notification through the portal that your new lab results have just came through. And your immediate thought is, I know it's bad news. Would anybody go there? Maybe some of you? No hands. Okay, you all think perfectly. All right. I know it's bad news. And then the emotion after that would be, what would be if you think something's bad news, how do you feel? Worried? Fear, anger, sadness, not this again. Oh my gosh, what if it came back? I don't know about you, but I may not get out of bed that day. I just may need like a total wellness day. So the idea is your thoughts are not, that your feelings are not facts. And we want to identify rational versus irrational thinking. I don't mean like think positive, but just like rational versus irrational. So I'm going to give you an example of that. I'm going to move through these. So this is my favorite slide. So you get a notification of new lab results. Rational thought will be, I don't know the results, and I'll be able to handle whatever lies ahead, and I can also call Jill Cisco. Seriously. So common cognitive distortions, we all do this, okay? All or nothing thinking, okay? If I can't do all the things I used to do, then life is not worth living. I don't know if that's rational, right? Rational things. Cognitive distortions, catastrophizing. Anybody do that? Catastrophizing, right? Blowing things out of proportion, okay? Now that I have this illness, my life is over. That's not rational thinking, okay? Shoulda, woulda, couldas, right? Directly feelings around guilt, feelings of anger. I should be able to handle this now. Would I ask other people for help? And self-care is what's really important to focus on now that this conference today is over. I want you to leave with self-care, self-esteem. How can you find the balance in your life with acromegaly? All change in life requires some level of coping. Also, what about, are there any losses in your life which are causing stress? What about, are you creating unneeded stress in your life? Choosing certain relationships, maybe not being so, firm on one thing, or setting boundaries with family. How are you taking care of yourself? I'm going to spend a few minutes later on grief and loss, because I think there's a lot of grief and loss with acromegaly, and not a lot of people talk about it. Coping is loss that's on a very deep personal level. There's no time frame, no pretty packages. The best thing you can do is allow yourself to feel the grief, the changes in your life because of acromegaly. And resisting will only prolong the natural process of healing. Denial, we talked, as a coping mechanism, right? Normal reaction to rationalize overwhelming emotions. And it's temporary, it tends to be temporary. If it's not temporary, deep-seated grief and loss can easily move to depression. It's normal to feel grief and loss over acromegaly, and not just upon diagnosis, maybe even throughout it. You may have periods of it. Anger, very common stage of grief is anger. Why me? Life is not fair. Why did all those doctors misdiagnose this? And I don't want you to be angry at the doctors. I want you to feel empowered. And if they don't know, to educate and work as a teammate with your physician. It's very important. And thank goodness, because a lot of patients have taught doctors many, many things, and they've become better doctors because of you. Bargaining, what if only? Be careful of guilt. It's very important. Depression, we've talked a lot about this. Isolation is common. That's why it's important for you who are new to connect with others here. Get their phone number, get their emails, stay in touch with Jill and the community. So, acceptance doesn't mean that everything's perfect now, and oh yeah, I have, just like, okay, I'm happy with my acromegaly. No. It just means you're at a place of maybe less shame, less anger towards the healthcare community. Still maybe always angry with insurance companies, but maybe you've worked on finding ways to wiggle around them and working with pharmaceutical companies or areas of getting some financial assistance. But I do believe that we move towards acceptance and not fighting it so much. So I've identified 3 books that I actually have read and really like. One is called Your Sorrow is My Sorrow. It's by Joyce Rupp, who actually is a Catholic nun. And so that, I would say, would be a book more to the Christian Catholic faith. The Jewish Book of Grief and Healing, a spiritual companion for mourning for those that follow that faith. And I don't have all the religions in the world here, so my apologies. And then Your Grief, Your Way. That's more like, forget these books out there on grief. I know my grief, and you're writing your own grief story. And so that's really, what is your grief and what's your journey been and how have you gotten through the other side? Support groups, couldn't say it more, that's why we're here. Thank you for Jill Sisko and everybody on her team. Support groups are critical because none of us, I'm not in your shoes, the pharmaceutical companies are not in your shoes, the nurse practitioners, nurses, physicians. We can teach you what we know our expertise, but you guys are in your shoes. So you've got to work together and advocate for this. And that's me. My private practice is in Los Angeles. I work with clients all over the world, and I'm happy to share my work. Thank you very much.